Hi, I'm Greg Packer. I'm the new Group Clinical Director for Musculoskeletal Services. So my clinical responsibility is for orthopaedic surgery, for rheumatology and for chronic pain across the three hospitals.
And in terms of the reconfiguration, what does that mean for your services?
So for my specialism, it means that the majority of care will still be delivered locally. So that means outpatient and day case work and also the normal trauma work. It means that some complex trauma will be localised into one or other of the hospitals, and it also means that the small amount of work that we do out of hours will be localised either to Basildon or to Broomfield. It also means for elective work we will consolidate it on the two sites, that's mid-Essex, including Braintree and Southend, and that allows us, we hope, to deliver a more effective elective profile, particularly as we will have a standalone elective unit and will localise certain subspecialities into certain hospitals, which means that we get an economy of scale we haven't had before. It's happening because we recognise that we're three middle-sized hospitals, and whilst we function pretty well, the problem we have is that we don't have the economies of scale that come from having bigger units, and that's particularly important for the more complex things that we do, such as subspeciality, elective and trauma work. And also it means that we don't or haven't until recently had a standalone elective unit, which means we're subject to the pressures of being in an acute hospital. The benefits for the patients will be that for the vast majority of their care we will still deliver it locally, whether that's elective work or trauma work, including fractures. But it does allow us to subspecialise, it allows us to put more people into one site and to specialise at certain sites for the more complex procedures that we do. And it also allows us to have an elective unit, which means that we can get through the elective work without being subject to the pressures of the winter and to the other pressures in an acute hospital. The benefits for the staff will be that for the vast majority of staff, they can stay exactly where they are and still work in the same hospital. For some of our staff, those who want to get involved in the more complex procedures or to become very subspecialised, it does allow them to do that. But it may mean that it'll be localised into one hospital or the other.